What is going on, world? Hey, so hopefully, hey, first of all, happy belated Merry Christmas. Merry Merry Christmas. Happy belated Merry Christmas to everybody. I hope everybody had a really good holiday time. If you guys are new here and you guys are just now joining, my name is Kevin. We are going to be doing NCLEX questions today. Look, I don't know what's going on with this curl right here, but your boy is curling and frizzing out today. So you guys already know what the deal is. We're going to be doing NCLEX. Hey, just because it's the holidays don't mean we stop working. All right, just because it's the holidays don't mean we stop working. This is where people get complacent, and this is where people fail, and we don't fail around here. We make shit happen around here. Samita, how are you? What's up, Miss Grace? How are you? Hey, so if you guys are new here, you already know what the deal is. Smash that like button. Hey, I need at least 1,000 likes before we get started, and I need 100 people up in here. Smash that like. Hey, get carpal tunnel for me. You know, hey, y'all ain't been doing nothing all weekend, so I know them fingers and them thumbs is fresh. Stop playing games with me, all right? Hey, y'all know we're gonna be doing. Shout out to Miss Ma'am from Montego Bay, always here, always present, always participating. So I appreciate you. We're going to be doing NCLEX questions. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us? But we're going to be doing NCLEX questions. I hope hopefully everybody had a really good Christmas holiday, or, you know, whatever holiday that you celebrate. Hopefully everybody had a really good time. But yeah, let me know down in the comments. I kind of chilled out, you know, went to go see some family. I got sick. It's not the Rona, but it's, you know, it's with other stuff. So, you know, what's up? It says, got my ATT today. Shout out to you, Miss Ma'am. Hey, so it's right around the corner. Hey, just because it's the holiday times does not mean we stop working. We got 165 people in here. We got 1,000 likes. You already know what the deal. I appreciate y'all. We're going to turn this camera around because I know y'all ain't trying to look at me. You know what I'm saying? But y'all already know the deal. Here we go. Let me get this thing fixed out right here. So we're going to be doing NCLEX questions. Of course, if you guys don't know, my name is Kevin, and we're going to do NCLEX questions. We do them every Monday, Wednesday, Friday, 5:30. And without further ado, let us jump into them. Here we go. Hopefully everybody can see that, which is why I love you, Star. I appreciate you. Here we go. Question number 1. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's labs results would expect which of the following changes in laboratory findings? Is it an elevated serum calcium? Is it a low PTH? Is it an elevated serum vitamin D? Or is it a low urine calcium? By the way, I need to put a timer on here because y'all take forever to be answering questions. But if anybody is curious about these questions, we got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. You guys can go over there and check those out for yourself. Also, don't come into my chat and try to rush me because I will ban that ass. I'm just letting you know. So I appreciate y'all. It says you should do a poll on here. Look, Star, I'm trying to just figure out my life, let alone try to figure out how to do a poll. So, you know, I'm trying to figure that out. There's only so much your boy could do. All right, here we go. 10 more seconds. You made it today. I know that's right. I appreciate you being here. By the way, hey, if you guys are new here, make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. That is the trifecta that TikTok needs for me to get it out to folks that need it, okay? So, get carpal tunnel for me. Make it happen right now. Do it. Do it now. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is A, elevated serum calcium. The parathyroid gland regulates the calcium level in the blood. In hyperparathyroidism, the serum calcium level will be elevated. A normal PTH is present with hypercalcemia, is considered inappropriate and still consistent with PTH-dependent hypercalcemia. That is part of reduction of risk potential. Smaller section on the NCLEX at like 9 to 15%. All right, so understanding where these questions come from, what category that they fall under will really help you determine, it'll help you narrow it down. It says, and so you get revenue, of course. I don't even understand what you said. So here we go. Shout out to everybody that got that question right. All right, here we go. Question number 2. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? So 3 of these are recommended. 1 of them is not. This is how you have to approach these questions, okay? So is it A, diet high in grains? Is it B, a diet with adequate caloric intake? Is it a high protein diet or restricted sodium diet? What are we thinking? What's up, Bella? I see you out there. Shout out to everybody just now joining. If you guys already have been here before, or if you haven't been here before, we're doing NCLEX questions, both for RNs and LPNs. Got them off nurseslabs.com. Free sets of questions. All right, so make sure you guys go over there and check that out for yourself. Hey, if you are still in school, I don't know what you're doing by not sharing this to people. Merry Christmas. You know what I'm saying? Don't be out here being selfish your whole life, all right? And make sure you smash that like button. Make sure you guys share. Make sure you guys follow, okay? I'm new here. Starts nursing school, graduating in December. Shout out to you. Is it Ariel? Ariel, shout out to you. All right, y'all, 10 more seconds. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, okay? We're on the road to 10,000 likes. 10,000 likes. That is the goal. That is the set goal that we're doing. Hey, if we don't get to 10,000 likes by the time we get to 10 questions, I'm boycotting the rest of these questions. Try me. You take your NCLEX tomorrow, Kristen, then get off my live. Kristen, either get off my live or I ban you. Which one you want? And I tell you that because you don't need to be here. You don't need to be here. I'm going to give you some positivity. You're good. All right. You are good to go. You know everything that you need to know. You studied and you prepared. So go away. Today is Monday. I expect for you to come back here on Wednesday and tell us that you passed. OK, but either you go away or I ban you. Which one you want? You let me know. But anyways, the answer is D. It says, what is the timer for each question? 1 minute? It just depends on how I feel. What you mean leave her alone? Hey, look, this is just what I do. And the answer is D, a restricted sodium diet. A patient with Addison's disease requires normal dietary sodium to prevent excess fluid loss. Do not reduce salt in the diet. Okay. The client may need to add extra salt to his or her food during hot and humid weather or after exercise to replace salt loss through sweat, right? So that is health promotions and maintenance, 6 to 12% on the NCLEX smaller section, but still, of course, very, very important. All right. So if you understand where they come from, you'll be able to narrow it down when you understand your answers. This is like what I walk in and how I get here. I don't know. You walked into greatness. You come into this live. We about that business, but we ain't about them jokesters. You know what I'm saying? But we out here putting in this work because we work on holidays. You know what I'm saying? We don't take breaks around here because you want to know who don't take breaks? People that are doing better than you. There you go. Here we go. Question number 3. A patient with a history of diabetes mellitus is in the second post-operative day following a cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is the most likely explanation of the patient's symptoms? Now paint the picture. This patient has diabetes, but they just came from surgery and they had their gallbladder removed, right? So what is the most likely explanation for them being confused and shaky? Okay, is it anesthesia reaction, hyperglycemia, hypoglycemia, or diabetic ketoacidosis? What are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. Y'all know I'm about that work. You know what I'm saying? We put in work even on the holidays. While people are taking breaks, we don't take breaks around here. You know what I'm saying? We don't take breaks around here. I want to know who you are, where you're from, where you're at in your nursing journey. Somebody asked me how long we do these questions or how long is each question. It could be a minute. It could be 30 seconds. It all just depends. Regardless, people complain. I don't really care about the people that complain. So I didn't ask you, Leslie, if it was real life. This isn't about real life. And that's exactly what the exam is. The exam is perfect world. So we don't answer based off real life. We answer off of perfect world NCLEX. That's what we do around here. Because that's exactly what the exam wants for you to do. All right, y'all, here we go. Here's our answer. Here's our answer in 3, 2, and the answer is C, hypoglycemia. Okay. It is a postoperative diabetic patient who is unable to eat is likely to be suffering from hypoglycemia. The actual treatment recommendation for a given patient should be individualized based on diabetes classification, usual diabetes regimen, state of glycemic control, nature and extent of surgical procedure, and available expertise. That is part of physiological adaptation, which is the third largest section on the NCLEX. Who said they're taking their NCLEX tomorrow? I'm taking mine tomorrow. Kennedy Drew, you have 2 choices. Either I ban you or you go away. And I'll tell you why. Because you don't need to be here trying to cram any of this information. Because if you don't know it by now, you don't know it at all. So I say that with nothing but love and respect, but you got to go and then come back on Wednesday and let us know how you did. All right. Don't try to cram. Don't try to cram. All right. Just go away. Go away and then come back on Wednesday. All right. Go relax. That's what the day before NCLEX is for you to relax as much as possible. OK, here we go. Question number 4. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increased abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? So somebody that had a colonoscopy 18 hours ago, are they supposed to have abdominal pain, fever, and chills? Probably not. That's probably not the expected outcome. So it could be something that is wrong, right? So we were looking for something that is wrong based off of that procedure. So is it a bowel perforation, viral gastroenteritis? Is it colon cancer or diverticulitis? What do we think? It says, waiting on my ATT for PN NCLEX, graduate on the 19th. Shout out to you, Miss Ashley. Tristan says A. Okay. Hey, if you guys are new here, welcome. It says, my girlfriend, Pastor Exit Hesse. Thank you. Shout out to her, Lynette. Shout out to her, Lynette. I remember you. Shout out to your girlfriend, Pastor, and tell her I said congratulations to her. Now she got one more step, and that's to get NCLEX, and that's it. Well, that ain't it. That's just the beginning. So, all right, I'll give y'all 15 more seconds. Hey, if you guys are new here, welcome. Hey, we're on the road to 10,000 likes. 10,000 likes. Thank you. Is it Clarisseville? Thank you for the flower. I appreciate you. Make sure you guys keep smashing that like button. You guys keep sharing, keep following. All right. It says, these lives are the reason I passed my NCLEX first time. Thank you. Shout out to you, Tristan. Shout out to you. I appreciate it. This is why I do it, providing value to those that need it. I wish I had something like this when I was in school, and I'm not even gonna lie to you, or at least I thought about it, But here we go. Here's our answer in 3, 2. And the answer is B, or it's A bowel perforation. Bowel perforation is the most serious complication of fiber optic colonoscopy. Important signs include progressive abdominal pain, fevers, chills, and tachycardia, which indicate advanced peritonitis. All right, that is part of reduction of risk potential. One of the smaller sections on the NCLEX, but still very important, 9 to 15%. They're broken up. Remember, there are 8 sections of client needs that have categories and subcategories that go all across everything you need to know for nursing. Okay, what do you think about the Hirsch review for your NCLEX? I think it's okay, but I personally can't do it because it's an environmental distraction for me because of how thick her accent is. But I think that Hearst is okay. I used Hearst, but Hearst did not work for me. Please continue these reviews. I graduate next December. Amanda, look, I'll be doing these reviews until y'all don't want me to do them. But I'll also start doing stuff off of TikTok that's going to be they're going to be more in depth than this. So y'all just be on the lookout for that. But here we go. Question number 5. A patient is admitted to the same day surgery unit for liver biopsy. Paint the picture of somebody. Do I recommend Archer? I do. Which of the following laboratory values assess coagulation? Select all that apply. So I should see multiple answers down here. All right. Multiple answers. All right. I'll give you guys 30 seconds. All right. If you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. Free sets of questions. Okay. You guys go over there, check that out. Hey, if you're still in nursing school, by the way, hey, they have really good nursing care plans over there. I'm telling you, I used them when I was in school. Every other nurse used them. Don't let them lie to you. Don't let your school scare you, telling you that it's cheating, because it's not fucking cheating, okay? Just letting y'all know that. Also, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. I'm struggling to pass the exit Hesse. How do I pass? I don't know. I don't know exactly what you need. That could be more of a thorough conversation of us having. So anybody that's ever interested in coaching or tutoring, you guys can check those links out there in my bio. What's a nursing care plan? Well, hey, once you get into nursing school, you will find out. And the answers are A, B, and C. So the prothrombin time, partial thromboplastin time, and the platelet count are all included in coagulation studies. Hey, remember, you need content, you need questions and answers, and you need rationales. Lynette, you are welcome. Hey, let them know, Lynette. Let them know how good the course is, and we'll talk about the course later. But that is part of reduction of risk potential, 9 to 15% on the NCLEX. San Antonio, you're from San Antonio, Texas. Hey, I'm from San Antonio, so shout out to you. Number 5, you know what I'm saying? So shout out to y'all. Reduction of risk potential. So make sure you guys are paying attention to that. All right. Paying attention to what categories that you are getting your questions from. That way you can narrow down when it's time to do your answers. But hey, real quick, y'all, I have some test taking tips to help you conquer the NCLEX. That link is in my bio, or you guys can go to that site right there, thebootnurse.com/test. Free to you. 42 pages. We have some stuff in there talking about, keywords to look out for, that way, hey, what exactly are they asking in regards to that? So every, lab values, cues, all different types of stuff. You guys go over there and you guys check that out. Hold on one second. By the way, if you guys see anybody come into my chat and they're trying to sell us nudes, let me know, because who tries to sell nudes when you get it for free? Anyways, question number 6. A patient on the cardiac telemetry unit unexpectedly goes into ventricular fibrillation. So VFib, right? The advanced cardiac life support team prepares to defib, right? For VFib, you defib. right? Which of the following choices indicate the correct placement of the conductive gel pads, right? Is it the left clavicle and right lower sternum? Is it right of midline, below the bottom rib and the left shoulder? Is it the upper and lower half of the sternum, or is it the right side of the sternum just below the clavicle and left of the pericardium? What are we thinking? What are we thinking? Shout out to all 500 of y'all in here rocking with me. Hey, y'all got me to 10,000 likes before 10 questions. I appreciate y'all. So you already know what the next milestone is, right? You already know 20,000 likes make it happen. You know what I'm saying? I appreciate y'all. I'll give y'all another 10 seconds. Got a bunch of people saying D's and B's. All right. Liv says D. Miss Carrie, thank you for the follow. Miss Carrie, baby. Lizzie, thank you for the follow. Appreciate you. Definitely. Okay, I see you. Definitely. Okay. A, D. All right. Well, let's see what the answer is. Let's see what the answer is. Mary and Tay, thank you for the follow. Appreciate you. Danielle, thank you for the follow. Stop that singing. Oh, Sasha, no, you did not come up in here being a ghost. Your baby over here being bad, by the way. I'm just letting you know. Here we go. Here's our answer in 3, 2. And the answer is D, the right side of the sternum, just below the clavicle and left of the pericardium. One gel pad should be placed on the right of the sternum, just below the clavicle, and the other just left of the pericardium, as indicated by the anatomical location of the heart. To defibrillate, the paddles, which we don't really use paddles too much anymore. I mean, but they still have them available. But the paddles are placed over the pads, all right? So that is part of reduction. It's real small. Reduction of risk potential. Remember, 9 to 15% on the NCLEX, all right? 9 to 15%. Hey, if you understand what categories or what the client needs that they fall under, you can actually start to kind of narrow down how your answer can be answered, okay? Oh my God, we miss him. Stop it. He's a turd. What I think about boot camp? I mean, I've been to boot camp for the Navy, and it's cool, but it's whatever. Here we go. Question number 7. The nurse performs an initial abdominal assessment on a patient newly admitted for abdominal pain. The nurse hears what she describes as clicks and gurgles in all 4 quadrants, as well as swooshing or buzzing sounds or buzzing sound heard in 1 or 2 quadrants. Which of the following statements is correct? The frequency and intensity of the bowel sounds varies depending on the phase of the digestion. In the presence of intestinal obstruction, bowel sounds will be louder and higher pitched. The swishing or buzzing sound may represent the turbulent blood flow of a brewy and is not normal, or is it all of the above? Like Mano. All the above, all the above. And here's a quick question for you guys. I'll give you guys 20 seconds, but this question, even though it says all of the above, these are very rarities that you would see on NCLEX. This would more likely be a select all that apply type of question. You may be overthinking. You just might be, right? All the above questions, when you see an answer that's all the above, those are the ones that you kind of want to watch out for, because it kind of makes it seem like it's a definite answer, right? But you also want to watch out for those. This is a question that, honestly, in my opinion, should be rewritten and put in select all that apply, because that is the format that NCLEX likes to do. Select all that apply. All right, here we go. Here we go. Let's see what the answer is. We got people saying A, we got D, we got C. Okay. All right, here we go. I'm in school for MA, and I'm going to go with A. Cool. Shout out to you, Sophia. C from Miss Mary. All right, here we go. Here's our answer in 3, 2. And the answer is D. All of the above. All right. Physiological adaptation, 3rd largest section on the NCLEX exam. All right. All of the statements are true. Abdominal examinations can give diagnostic clues regarding most gastrointestinal and genital urinary pathologies, and may also give insight regarding abnormalities of other organ systems. Remember, physiological adaptation. You start hearing like a swooshing sound in the abdomen. Look, you might want to call a doctor. Call the doctor, all right? Because we're thinking of some type of abdominal aortic aneurysm that could be happening. All kinds of craziness that could be happening up in there, especially and trust me, it's very distinct if you hear it. All right. So shout out to everybody that got that question right. Remember, 3rd largest section on the NCLEX. 3rd largest section on the NCLEX. Okay. Here we go. Question number 8. The patient arrives in the emergency department and reports splashing concentrated household cleaner in his eyes. Which of the following nursing action is a priority? So what is the very first thing that I should do to somebody who comes into my emergency room who had some type of household cleaner splashed into their eyes? Do I want to irrigate the eyes repeatedly with normal saline, flush with fluorescein drops in the eye patch, or test visual acuity. What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions both for RNs and LPNs. Got them off nurseslabs.com. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Hey, we're on the road to 20,000 likes. 20. Everybody's over here telling me A. So we're about to see what the answer is. But also, I want to know who you are, where you're from, where you're at in your nursing journey. Too easy, maybe too easy for you. But you got to think, there are other people that are in here that are in different stages in their nursing journey. So it may not be easy for them, or people that are in here that are not even nurses that are participating. So maybe easy for you, but not easy for others. All right. Here we go. Shout out to VA. Been there a few times. Maryland. Been there a few times. Hi. What does it says? Hi. Thanks for doing these. I'm a nursing student who'll be graduating soon. I am low-key scared. You're not low-key scared, or she wouldn't have told me that. So you're actually very scared, and that's okay. Here we go. Here's our answer. In 3, 2. Bella, why you keep screaming my name like that? What happened? Shout out to Indiana. Indianapolis, okay? But what are we talking about? So the answer is A, irrigate the eyes repeatedly with normal saline solution. Emergency treatment following a chemical splash to the eyes includes immediate irrigation with normal saline. The irrigation should be continuous for at least 10 minutes. Immediate irrigation with copious amounts of isotonic solution is the mainstay of treatment for chemical burns. That is physiological adaptation, which is the third largest section in the NCLEX exam at 11 to 17%. Miss Minnie, shout out to the Philippines. They're all correct, but which one is most correct? Absolutely. What is the one that is most correct? Starting nursing school on the second. 6 years deep in this nursing game. I'm 3.5 years deep in this nursing game. All right. Question number 9. The nurse is caring for a patient who had a hip replacement. The nurse should be most concerned about which of the following findings: complaints of pain during repositioning, scant bloody discharge at the surgical site, complaint of pain following a physical therapy, or a temperature of 101.8. What are we thinking? Hey, so a little bit about me. I've been a nurse for 3.5 years. I have worked in a burn ICU, a neuro, and a medical ICU. I've worked in PACU, as well as I've worked in the operating room. Like I said, been a nurse for 3.5 years. Been an instructor / educator. Next month, it'll be 9 years. So I taught in a surgical technology program. I'm a trauma nurse instructor now. I've taught a whole bunch of other programs. So I thoroughly enjoy doing this coaching and teaching things. So I appreciate all y'all being here. Who just said shout out to Neuro ICU? Shout out to you, Mia. Neuro's not really my speed, but I floated down there a few times and I was like, all right, cool. Y'all different or whatever. So shout out to y'all. Shout out to all my neuro folks. You're awesome. Mary, you're awesome. And I appreciate you being here. But here's our answer. Everybody's screaming D at me. All right, here we go. Here's our answer in 3, 2. Veronica, don't you rush me. The hell think this is? But of course it is the temperature. It is the temperature of 101.8. Post-surgical nursing assessment after hip replacement should be principally concerned with the risk of neurovascular complication and development of infection. A temperature of 101.8 post-operatively is higher than the low grade that is to be expected and should raise concerns. All right. That is part of physiological adaptation, right? The THA post-operative wound complication spectrum ranges from superficial surgical interventions such as cellulitis, superficial dehiscence, and or delayed wound healing to deep infection resulting in full thickness necrosis. So think about it. They're getting a hip replaced. They're going all the way down to the joint. You get an infection down there. It's all she wrote. So that's one of those things that you have to pay very much attention to make sure that they don't have surgical site infections. Okay. I work in a trauma department. Amazing. I would love to work once I pass my, do it. Do your thing. You can do it. All right. Osteomyelitis. Yep. You think about those things as well. Necrosis. All right. Shout out to y'all. And here we go. Question number 10. A child is admitted to the hospital with an uncontrolled seizure disorder. The admitting physician writes orders for actions to be taken in the event of a seizure. Which of the following actions would not be included? So 3 of these are going to be included. 1 of them is not. Just like that. All right. Been a nurse for a long time. Grandma here, always the best correct answer. What you mean, Grandma? I don't know. You got to let me know. Is it A, notify the physician? B, restrain the patient's limbs? C, position the patient on his or her side with the head flexed forward, or administer rectal diazepam? What are we thinking? B, who restrains them? Okay. Not me. Not I. Shout out to all 600 plus of y'all in here rocking with me. We are doing NCLEX questions. I appreciate everybody being here, wanting to get their learn on. I appreciate y'all still wanting to put in work because you realize that the work never stops. You got to put in that work if you want to achieve that goal. And everybody's goal here is either to get into nursing school, graduate nursing school, get that license and get out there and put that work in for you to do what you need to do as a nurse, either be an RN or an LPN. All right. And by the way, LPNs are nurses too. Don't y'all come out here being fucking disrespectful. All right. Because I check people that be disrespectful to my LPNs, my LVNs. So shout out to y'all. I love y'all. You know what I'm saying? But here we go. Here's our answer in 3, 2. And the answer, of course, B, which is restrain the patient's limbs. We never restrain patient's limbs at all. You know what I'm saying? We never, yes, child. We are nurses and I'm an LPN. I know that's right. LPN for 30 years. Shout out to you. During a witness seizure, nursing action should focus on securing the patient safely and curtailing. Who says curtailing? But curtailing the seizure. Restraining the limbs is not indicated because strong muscle contractions can cause injury. I have seen people actually try to do that as they're seizing, and I'm like, let go of their arm. Like we gotta turn them on their side. We got to do X, Y, and Z. And they're just like, sometimes it becomes a reaction where people just start grabbing, shaking limbs. And I'm like, no, let go. Like, as long as we have them controlled, then we're good to go. All right. But we don't ever want to restrain them like that. What's up, Kate? I know you're in here. Lurking. I see you. Here we go. Hey, but real quick, y'all, I have an ebook out there too. I call it the NCLEX Victory Guide because we're always on the road to victory, because you want to know why? The path to conquering the NCLEX begins with you. And I'm just letting y'all know. What's up, Caitlin? How are you? Hey, so the path to conquering the NCLEX begins with you. You guys can check that out. It's thebootnurse.com/victory, because we're all on the road to victory, right? And that link is in my bio. You guys can check that out at your leisure. But check out that fanny pack, though. You see what I'm saying? So there we go. Hey, everybody, I'm letting y'all know right now, if y'all don't got a fanny pack, stop playing with yourself. Pause. But you know what I mean. Go get you a fanny pack. They are going to save you a ton. We appreciate you for this. Jenna, I enjoy doing this, so I appreciate you being here. But hey, go get a fanny pack. Stop playing games, okay? Here we go. Question number 11. A patient who has received chemotherapy for cancer treatment is given the injection of epoetin, right? Which of the following should reflect the findings in a complete CBC drawn several days later? Is it an increase in neutrophil count and hematocrit and platelet count, or serum iron? Or if you're from Baltimore, it's EARN. Hey, I'm just playing. Hey, don't come for me, bro. I'm sorry. I mean that out of all love and respect for anybody that's like from Maryland or Baltimore. You know what I'm saying? So shout out to y'all. Appreciate y'all. I'm gonna give y'all 25 seconds, probably less than that. Shout out to you, Nikki. Nikki, I'm glad that Baltimore. Hey, did I say it right? Let me know. Oh man, I appreciate y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Dion says this is helpful. Dion, I'm glad that it's helpful for you, brother. I'm glad. From Jamaica, Miss First Lady. NYC, shout out to Brooklyn. I don't know nothing about Brooklyn. That just came out of nowhere. My grandma lives in Harlem. You know what I'm saying? I did it right. Oh, okay, cool. Appreciate y'all. Appreciate all 1,000 y'all in here rocking with me. I want to know who you are, where you're from, and where you're at in your nursing journey. All right, and here we go. Here's our answer in 3, 2. Oklahoma. I mean, shout out to Oklahoma. You know, I'm a Texas boy. We're going. Hey, Longhorns going to that game. Y'all already know what the deal is. But the answer is B. We're not going to get off track. But the answer is B. An increase in hematocrit. Epoetin is a form of erythropoietin, which stimulates the production of red blood cells, causing an increase in hematocrit. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%, or if you're reading another document, it'll be 13 to 19%, but whatever. It's still the second largest section on the NCLEX. Be very prepared to understand what your medications look like. And also, hey, remember, blood and blood components, IV fluids, that's all part of pharmacological and parenteral therapies, okay? So don't y'all forget that, all right? What does that say? It says, oh my God, I watch these every night, and I just got into... That's what I'm talking about. Is it Giovanna? Shout out to you, Giovanna, for getting into a program. Shout out to you, Miss Ma'am. Question number 12. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with this diagnosis? Select all that apply. Which means I need multiple answers. I need multiple answers down there. Multiple. All right. Is there a mod here? Nope. I'm the mod. Cocomelon. So is it weight loss, increased clotting time, hypertension, headache, tinnitus? What are we thinking? I'm working on getting a mod. Cocomelon. B and C. Okay. B and C. All right. All right, all right. Shout out to all y'all. Hey, you already know we hit that milestone, 20,000 likes. You already know what the deal is. You already know what the next milestone is. You already know. But, you know, I'll give y'all a little leeway till we get there. We got BCD, CDE. Okay. 10 more seconds, y'all. 10 more seconds. Another little thing about me, I've been in the Navy, the United States Navy, for 16 years. Was an LPN / hospital corpsman in the Navy, been a surgical tech, I'm a master instructor in the Navy as well. So been doing this education thing for a long time. So I appreciate everybody wanting to be here to learn. Ashley says, thank you for your service. Ashley, I appreciate your support. Thank you. But here's our answer. How old am I? How old do I sound? That doesn't even mean anything. I don't know what that means. It says, Sasha says, nobody cares about the Navy. It's all about the Air Force. Sasha, get out of my chat playing games before I ban that. Sasha, I'm tired of you. I was a corpsman too, but Sasha, I'm tired of you. And you ain't even been here. You better stop it. Leah, I appreciate your support. Thank you. But the answers are B, C, D, and E. Polycythemia vera is a condition in which the bone marrow produces too many red blood cells. This causes an increase in hematocrit and viscosity of the blood. Patients can experience headaches, dizziness, tinnitus or tinnitus, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time, which is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Appreciate all the follows. Thank you, guys. But yeah, physiological adaptation, third largest section. Hey, remember, physiological adaptation deals with acute, chronic, traumatic type of conditions, right? A lot of your pathophysiology is understanding the disease processes, okay? So here we go. Question number 13. Sorry if you guys hear my my co-star in there, but he's a brat. I'm just letting y'all know. Sasha, your baby is a brat, okay? Question 13. The nurse is caring for a patient with a platelet count of 20,000 microliters. Which of the following is an important intervention, right? So what am I thinking about when it comes to my platelets? First of all, think about what are the normal platelets, all right? And what is happening if it's too low and what's happening if it's too high? And what are the safety implications that I need to do as the LPN or RN to prevent what? Right. So is it observe for evidence of spontaneous bleeding, limit visitors to family only, give aspirin in case of headaches, or impose immune precautions? What are we thinking? We got A. Everybody's screaming A at me. A. What sound does that letter make? Tell me. What we doing? So we got A out here. Is it B? I appreciate the follow. Normal platelets 150 to 400. Okay. All right. Get my son love. He over here acting up. Let me tell you. I'm trying to tell you. He ruled a house but don't pay a bill. What kind of hellness? What kind of hellishness is that? Look for the evidence of bruising. Okay, Philly failed my RN exit by 2 points. I'm an LPN. Hey, so how are you gonna go back? And my question is, how are Grace's corner? Grace, you know what the deal is? That's my hey. All right, that's how I learned my alphabet. You know what I'm saying? But to that individual that just said they failed their exit Hessing, now you got to regroup. Delayed, never denied. All right. Delayed, never denied. Okay. Here we go. But the answer is A. Observe for evidence of spontaneous bleeding. Platelet counts under 30,000 may cause spontaneous petechiae and bruising. Somebody literally just said that. All right. Particularly in the extremities. All right. Reduction of risk potential. 9 to 15% on the NCLEX exam. Do you do these streams often? I'm going into my second semester of third year. I do these streams Monday, Wednesday, Friday at 5:30. All right. Unless, holidays times, I probably won't be doing it on Monday. Who knows? No, fuck it. I'm going to do it on Monday because it's just New Year's. You know what I'm saying? And I'm not going to be hungover like most of y'all. You know what I'm saying? So it says, hold on. It says, I take my NCLEX tomorrow. So this is now, nope. Whoever you are, ma'am, you need to go away. I'm going to give you two choices. You're either going to go away or I'm going to ban you. And I'm going to tell you why. Because you don't need to be here this is what I would consider cramming. All right. And you don't need to cram. This is where you relax. Don't let your anxiety take over. All right. You're going to be scared taking your exam. And I know that's how you feel. And I know that's why you're here. But I'm telling you right now, you're going to be scared and you're going to do it anyway. So you need to get off here and you need to try to relax as much as possible. All right. It's like, I know, don't cram. If you know, don't cram, then you need to get that ass off this live. And I say that with the utmost respect, okay? So, ma'am, go away before I ban you, all right? Here we go. Question number 14. The nurse in the emergency department assesses a patient who has been taking long-term corticosteroids to treat renal disease. Which of the following is a typical side effect of corticosteroid treatment? Select all that apply. It says, okay, thank you, good night. Hey, but come back though. Come back on Wednesday and let us know how you did. All right. This is we foster good community-ness here. All right. This is what we do. And this is what I foster. You come in here with that negativity. Hey, best believe I check people all the time. So shout out to y'all. Hey, if you guys are new here, welcome. We're on the road to 30,000 likes. On the road to 30,000 likes. Make sure you guys like, share, follow. I'll give you guys 15 more seconds to select all that apply. All right, got these questions off nurseslabs.com. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you need help with NCLEX, and if you have not been successful, once, twice, 3 times, then check out. I do coaching. I do NCLEX coaching specifically for people. So if you need help with NCLEX and how to conquer it, check it out. Go over there, schedule a 15-minute appointment for yourself, and I have like an intake form, and maybe we can work together. See what we can do for you. All right. But let's check out our answer. Here's our answer. Our answers are A, B, and C. All right. So, I'm sorry. It's D. Obviously, I don't know how to read, but it's A, B, D. So Alpha, Bravo, Delta. Part of pharmacological and parenteral therapy. Second largest section on the NCLEX exam, y'all. Second largest section. Anytime you see a medication, you might as well just assume it's part of pharmacology. All right. Side effects of corticosteroids include weight gain, fluid retention with hypertension, cushingoid features, a low serum albumin, and suppressed inflammatory response. Patients are encouraged to eat a diet high in protein, vitamins, and minerals, and low in sodium. Remember, pharmacological and parenteral therapies. Pharm, it says why you had to use military words, Lord Mercy. Look, I'm sorry. It's not my fault that I'm militarized, okay? It's not my fault. Look, there's a lot of things I'm going through, all right? And I'm trying to figure it out. So why is E wrong? Hey, that's another thing. I'm not going to go back, all right? And that's another thing. When you guys are reading your answers, you have to be able to know your content, read your answers, understand the keywords that are inside of your questions, and then you have to read your rationales. All right. I don't go into why they're wrong. That's your responsibility to go into why they are wrong. All right. This is another thing I talk about in my coaching, even though we go through questions together. All right. Here we go. Question number 15. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? All right. So first of all, what does neutropenic mean? For those that don't know, if you don't know, ain't nothing Google can't show you. All right. And there's nothing that somebody can't answer for you down there. Shout out to you. Is it Shayna? Shout out to you. So is it to change the disposable mask immediately after use, change gloves immediately after use, minimize patient contact, or minimize conversation with the patient? All right. Keep the patient safe. Neutrophil, low white blood cell count, ABC are the same answer. So what happens if you have the same answer? What happens if you have the same answer? All right. No fresh flowers, no fruits. Okay. Somebody asked me how much the coaching costs. So the coaching actually, it varies. It varies because everybody is different. Some people need more, some people need less. So it all just really just depends on what you need. Cluster care. Okay. Cluster care. I like that, Abby. Why don't you explain? What are you talking about? We're talking about I'm about to explain what the question is right now. I'm about to explain it right now. What's up, user 69? How are you? Immunocompromised. Okay. What's up, Sasha? Ew, Sasha. Hold on one second, y'all. Somebody came in here trying to sell me nudies. Y'all already know what the deal is. We don't take nudie sales inside the chat. All right, here we go. Here's our answer in 3, 2. And the answer is B, change gloves immediately after use. The neutropenic patient is at risk for infection. Why? They have a low white blood cell count. That's what we just now talked about, right? Changing gloves immediately after use protects patients from contamination with organisms picked up on hospital surfaces. I don't know if you guys ever been to a hospital, but it's disgusting, right? This contamination can have serious consequences for an immunocompromised patient. Wear gloves when providing direct care. Perform hand hygiene after properly disposing gloves. That's part of physiological adaptation. Third largest section on the NCLEX at 11 to 17%. That's a stupid question. Well, all right, here we go. Hey, I don't know what this is. I don't know what that is. I think I already showed you guys this, but hey, if you guys are looking for a good ebook, you guys can go check that out. It's on my website, but it'll take you directly there, thebootnurse.com/victory. Okay. No idea how that got there. You know what I'm saying? But here we go. Question number 16. A nurse is counseling patients at a health clinic on the importance of immunizations. Which of the following information is the most accurate regarding immunizations. Okay. So what are we thinking? Think about, hey, why do we give them? What is it at? Like, think about everything that you could think of when it comes to immunization, even the time stamps of when immunizations are given, because you never know what the question is going to be asking you. Once you start to collaborate all of that information, then read your answers, and then you'll be surprised on how well it'll stick out. Okay, so is it A, all infectious diseases can be prevented with proper immunizations? Immunizations provide natural immunity for diseases. Immunizations are risk-free and should be universally administered. Or is it D, immunizations provide acquired immunity from some specific diseases? What are we thinking? Everybody screaming D at me. Screaming D at me. It says, I love it. It's fast-paced. Look, I don't like usually doing it fast-paced, but, you know, some people, hey, this is TikTok. Some people attention span's 15 seconds. So it's like squirrel. All right, 10 seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys go over there and check those out. Free sets of questions. If you're a nursing student, they do nursing care plans over there as well. Go check them out. I used them. Other nurses used them. It's not cheating. Trust and believe me, okay? This is my first time here. And I'm enjoying this. I'm glad you're enjoying this. This is what we're about. This is what I'm about. I appreciate y'all being here. Here we go. Here's our answer in 3, 2. And the answer is D. For sure. Your name is Felicia? Oh, you already know what I'm about to say. You know it's coming. You know it's coming, Felicia. But hey, it is D. Immunization provides acquired immunity for specific diseases. Immunizations is available for the prevention of some, but not all specific diseases. This type of immunity is acquired by causing antibodies to form in response to a specific pathogen, right? That is part of health promotions and maintenance, 6 to 12% on the NCLEX exam. Are you waving bye to me? Oh, you said it before me? Damn, that's messed up. But nah, Felicia, you can stay. We cool. Hey, so health promotions and maintenance, all right? Smaller section on the NCLEX, but very, very important, right? Of understanding how the content goes. All right, Felicia, I see you. All right, here we go. Question number 17. We have a patient is brought to the emergency department after a bee sting. Paint the picture. The family reports a history of specific allergic reactions, and the patient appears to have oral swelling. Okay, so now what am I thinking? Now I've gotten a little bit more information, so now I'm having oral swelling. What could be happening after that? Which of the following is the most urgent nursing action? Do I want to call the doctor, maintain a patent airway, epi sub Q, or do I want to do diphenhydramine orally? So, and understand, yeah, your ABCs, right? Maslow's, right? What are we thinking? Remember, urgently, like, what do I need to do right now? Who's going to die? Like, now who's going to die? What do I need to do? Because if I don't do it, my patient is going to die. Shout out to all 800 of y'all. Hey, we're on the road to 30,000 likes. We are on the road to 30,000 likes. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Yeah. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. By the way, here's another thing you guys probably don't know, but I failed my NCLEX 3 times, y'all. 1, 2, and 3. 3 times, right? So I failed it 3 times. And let me tell you something right now. No one cares. No one cares how many times you fail. No one. And none of y'all would have known I failed until I just told you that. None of you, especially if you're new here. All right. So get out of your way. Get out of your own head. Get out of your depression. Get out of your anxiety. Get off your beach, as I like to say. All right. Get off of it. Because you're going to be scared regardless. You're not going to do well, and that's okay. You want to know the thing about failing is that you use it to audit yourself for what you didn't do to improve upon as you go and you do better. You see what I'm saying? So get out of your way. Get off your beach, right? Push through. Because if you stay on the beach, you're going to die. But the answer is B. All right, maintain a patent airway, of course, right? Because in the stem of the question, they said, hey, my airway's starting to go. I need to maintain that airway so my patient doesn't die. Right? The patient may be experiencing an anaphylactic reaction. Airway management is paramount. Thoroughly examine the patient for airway patency or any indication of an impending loss of airway. That is part of physiological adaptation, which is the 3rd largest section on the NCLEX. All right. You got to think ADPI. You got to think, hey, don't forget the things that you learned in school. ADPI, important, right? You got to think about Maslow's physical versus psychosocial, right? Did I need more information? Or was there enough information in the stem of the question to where I could implement and I could do something right now? There was. It clearly said that I was losing my airway. So what do I need to do? Maintain my airway. Because if I do another step before that, my patient could potentially die. That's not what we want. We want to be able to I want to maintain airway before I call doctor. Hey, airway's fault. Somebody call a doctor, right? Pay attention to those things, all right? Here we go. Question number 18. A mother calls the clinic to report that her son has recently started medication to treat ADHD. The mother fears her son is experiencing side effects of the medication or the medicine. Which of the following side effects are typically related to medicines used for ADHD? Select all that apply. Is it poor appetite, insomnia, sleepiness, agitation, or decreased attention span? What are we thinking? This is a select all that apply. So I expect a bunch of people to give me multiple answers. All right. Appreciate everybody rocking with me. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com, free sets of questions. So go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Right now, we're on the road to 30,000 likes. 30,000 likes. All right. So I appreciate everybody in here rocking with me. But like I was saying, y'all, get out of your own way. Get out of your own way. If you fail your NCLEX, hey, you tell me you fail your NCLEX, you get 24 hours to pout. But you got to take action. You got to take action. All right. And I'll tell you guys a little something about that too. Also, after these questions, I'm going to do an Ask Me Anything too. So you guys can definitely ask me whatever questions, that are paramount to you. Nursing school, getting into nursing school, all that good jazz. Thank you. I'm just scared to take it again. Why? Were you scared to take it the first time and you did it anyway, right? So why wouldn't you be? You're going to be scared to take it a second time, but you're going to do it anyway, right? Hey, look, we got 1,000 people over here listening to me run my mouth. So here we go. Here's our answer. Our answers are A, B, D, and E. So Alpha, Bravo, Delta, and Echo. Okay, Sasha, I see what you're saying now. Anyway, ADHD in children is frequently treated with CNS stimulant medications, which increase focus and provide concentration. Children often experience insomnia, agitation, and decreased appetite. ADHD treatment commonly uses a combination of dextroamphetamine and levoamphetamine, as well as a pure dextroamphetamine and lisdexamfetamine. Look, don't know. Sometimes I mess them up, and that's okay. All right. Pharmacological parenteral therapies, second largest section on the NCLEX. All right, 14 to 18%, or 13 to 19%, depending on whatever other pieces that you're reading. But it's still the second largest section on the NCLEX. By the way, I have people coming here trying to tell me how to pronounce stuff. Look, I'll just be completely real. Do I look like a 10-year-old getting ready for a spelling bee? Absolutely not. Absolutely not. Hey, it's very important that you read your questions, you do your answers, you do your rationales. Even if you got the question right, you need to do that, and you need to get into a routine of doing that. The largest section on the NCLEX is management of care at 18 to 23%. It is the largest section, management of care, who do you see first, delegation, assignment, so on and so forth. That's the largest section on the NCLEX. Question number 19. A patient in a mental health clinic is taking Haldol for treatment of schizophrenia. She calls the clinic to report abnormal movements in her face and tongue. The nurse concludes that the patient is experiencing which of the following symptoms? Is it comorbid depression, psychotic hallucinations, negative symptoms of schizophrenia, or, is it tardive dyskinesia? I always mess it up. I say tardive, but whatever. What are we thinking? Shout out to all 700 of y'all in here rocking with me. We're doing NCLEX questions. Make sure y'all smash that like button. We're on the road to 40,000 likes. 40,000 likes. Appreciate everybody in here rocking with me. Also, like I said, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here rocking with us? It says, remember your education, knowledge, and training. Make sure a nurse NCLEX just allows you to practice. Yep. You learn and trust. And listen, here's another thing for you guys too. You will learn how to do and be a nurse when you start working as a nurse. No, let me rephrase that. You will learn how to work bedside and be a bedside nurse when you start working in the hospital or you start working in those clinics. You're a psych nurse. Shout out to psych nurses. You be out, K-Pink, you be out there ready to fight folks, huh? Psychiatry resident. Shout out. Is it Karishma? Karishma. Shout out to you, Karishma. All right, y'all. Here we go. In Winnipeg. That's in Canada, right? Yeah. Shout out to Canada. Okay. Got a lot of Canadians up in here hanging out with me. 38 years as a nurse. Shout out to you, Debbie. Here we go. Here's our answer in 3, 2. And the answer is tardive dyskinesia. Hey, if I said tardive wrong, no part of me cares about what you think. Abnormal facial movements and tongue protrusion in a patient taking Haldol is most likely due to tardive dyskinesia, which is an adverse reaction to an antipsychotic. Tardive dyskinesia is a syndrome that includes a group of iatrogenic movement disorders caused by the blockage of the dopamine receptors, which is part of pharmacological parenteral therapies. All right. Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. Second, all right, second largest section, it says, "You are so real, haha, I love it." Was it third year med student? I love the content. Ariana, I appreciate you. Hey, I'm just being completely honest. If I tell you I don't know how to pronounce something, like, what y'all gonna do? Sit here and be like, oh my God, he's a shitty nurse because he doesn't know how to pronounce a word? Or is it about the skills that you provide when you take care of a patient and you do it the right way? You know what I'm saying? I tell people to get up out my face with all the nonsense. You know what I'm saying? So here we go. Question number 20. On the road to 40,000 likes, a patient with newly diagnosed diabetes mellitus is learning to recognize the symptoms of hypoglycemia. Which of the following symptoms is indicative of hypoglycemia? Is it polydipsia? Is it confusion, blurred vision, or polyphagia? What are we thinking? Right? Indicative of hypoglycemia, right? Shout out to everybody that's in here rocking with me. We're going to 40,000 likes. 40,000 likes. 40,000 likes. If you guys are new here, welcome. NCLEX questions. Got them off nurseslabs.com. Also, they have nursing care plans over there for all my nursing students. So, hey, if you're about to start nursing school in January, trust and believe me when I tell you. Trust and believe me when I tell you. You want to definitely use those, okay? Give you guys 10 more seconds. The first time on here and I'm enjoying these. I appreciate you. Hey, if you're a first timer on here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, if you're a resident, you know, like who was it that was a resident? Ariana, like, you know, so hey, if you out here doing that, do your thing. All right, here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B, confusion. Confusion with hypoglycemia. Hypoglycemia in diabetes causes confusion, indicating the need for carbohydrates, right? So the neuroglycopenic signs and symptoms are signs and symptoms that result from direct central nervous system deprivation of glucose. These include behavioral changes, confusion, fatigue, seizures, coma, and potential death if not immediately corrected. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Here's another thing. If you know somebody personally that suffers from these, then, you know, you can actually relate. Like, I'll give you an example. This is a little personal. My grandpa died from hypoglycemia. He died from going into a diabetic coma. Went into a diabetic coma while he was driving and they couldn't find him for multiple days. All right. So when it comes to diabetes, this is one of those ones that I hold near and dear to my heart to where I can remember. By the way, y'all probably don't know this young lady, but this right here is Helen. Helen actually did my coaching, and she actually did a testimony for me that I put up on my YouTube and I put up on Instagram and I put up on TikTok. She passed the NCLEX PN in 30 days working with me. This is a rock star of a woman right here. Super grateful, super awesome, very coachable. But go over there and check that out. I want you guys to go over there and look at that and check that out for yourself. Tell me what you guys think. Hey, and if you guys are interested in any type of coaching, you guys know where to find me. Check those links out in my bio. Okay, here we go. Question number 21. A child is admitted to the hospital with a diagnosis of Willem's tumor stage 2. Which of the following statements most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not extend beyond the kidney and was completely resected. The tumor extended beyond the kidney but was completely resected. The tumor has spread into the abdominal cavity and cannot be resected. What are we thinking? I'm gonna give you guys 30 seconds. I know this is some people are just like, yo, that's a tough one, and I don't blame you. So I'll give you guys 30 seconds. So what are we thinking? We got C. Somebody was asking in here, hey, what type of what are some really good reviews out there? So if you guys don't know, I have an NCLEX review. My NCLEX review is called the 7-Day NCLEX Course. Whole premise of it being 7 days is because I'm not the type of person that wants to sit at a 3-day NCLEX review and cram all that information into my brain. So I spread it out over 7 days. All I say to you is like, hey, Give yourself an hour to 3 hours a day for 7 days to review some good content and some questions and see how you do that for yourself. It's an on-demand course. It's not a live course, so you can take it at your own pace. So if it takes you 7 days and you want to do it, cool. If not, you can do it as fast as you want. All right, here we go. Here's our answer. Here is our answer. Hold on one second. Now, if I can. Oopsie. Sorry, guys. In 3, 2, and the answer is C. The tumor extended beyond the kidney, but was completely resected. Stage 2, the tumor extends beyond the kidneys, but is not completely resected. Stage 2 would be a tumor that has grown outside the kidney to some degree, such as into the surrounding fatty tissues. Usually, the tumor will be completely removed by surgery, and regional lymph nodes are negative. About 20% of all Wilhelm tumors are at this stage as part of physiological adaptation, which of course is what the third largest section on the NCLEX exam. It says, I'm on a roll like a hot dog. Please let my NCLEX be just like this. So here's the thing. So a lot of people are just like, yo, these questions are easy. This is just the tip of the iceberg, y'all. Like, this is just me giving you guys the tip of the iceberg. In reality, you guys got to keep doing questions, and the questions have to get harder. And let me tell you something that probably a lot of people don't tell you, but on NCLEX, you have to get to the hard questions. You have to get to the hard questions, okay? Once you start getting hard questions, you can think to yourself, okay, I'm doing pretty well. And then, computer adaptive testing. That's exactly what the NCLEX is. And then to start to give you something based off of what you are giving it, based off of your answers. Question 22. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Select all that apply. Is it a urine specific gravity of 1.040, urine output of 350 in 24 hours, brown tea-colored urine, generalized edema, or periorbital swelling, or 1, 2, 3, all of them? What are we thinking? A, C, D, E. Hey, if you guys are new here, welcome. We are doing NCLEX questions. Shout out to all 350 of y'all in here rocking with me. Make sure you guys like, share, follow. That is the trifecta that TikTok needs to get this to the people that need it. By the way, if you're still in school, I don't know what you're doing by not sharing this to somebody in your cohort. You may not like them, and I understand that, but I might like them. So bring them here. All right. Hey, smash that like button. All right. We need 40,000 likes. That's where we're going. Also, if you guys are looking for these questions, I got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. Also, some really good case studies over there. Not case studies, care plans, nursing care plans over there for you guys, okay? For nursing students. But here we go. Here's our answer in 3, 2. And the answer is A, B, C, and E. Okay? Acute glomerulonephritis is characterized by high urine-specific gravity related to oliguria, as well as dark tea-colored urine because of the large amount of red blood cells. As the glomerular filtration rate is decreased, symptoms like edema and hypertension occur, majorly due to the subsequent salt and water retention caused by the activation of the renin-angiotensin-aldosterone system. All right? I can guarantee you this is part of a physiological adaptation. I just didn't put it in here, but physiological adaptation, which is the third largest section on the NCLEX exam. Okay, third largest section on the NCLEX. Have to hop off, but it's been fun. Thank you, Kara. I appreciate you being here. Thank you. So make sure you guys need content. You need Q&A. You need rationales. That's what you need. That's what you need. All right, here we go. Question 23. Which of the following conditions most likely causes acute glomerulonephritis? All right, a congenital condition leading to renal dysfunction. Is it prior infection of group A staphylococcus within the past 10 to 14 days? Is it a viral infection of the glomeruli, or is it nephrotic syndrome? What are we thinking? Shout out to all y'all in here rocking with me. What are we thinking? Everybody screaming B. We got one person that said C. Well, another person that said C. Abby says C. Before I go, Kara, what happened? What you doing? What you doing before you go? Is that Laura? Thank you for the follow. Appreciate you. I'm working on doing polls, y'all. I'm a one-man army. I'm working on doing polls. I'm working on getting a mod, all that good stuff. Because there's so many of y'all, but only one of me. So I want to try to, make that as active as possible. Tasha and Leilani, thank you for the follow. Audrey, thank you for the follow. Milk, thank you for the follow. Appreciate you. Here we go. Here's our answer, y'all, in 3, 2. And the answer is B. Michelle, thank you for the follow. So prior infection with group A staphylococcus within the past 10 to 14 days. Acute glomerulonephritis is most common. Is most commonly caused by the immune response to a prior upper respiratory infection of group A staphylococcus. Physiological adaptation, third largest section on the NCLEX at 11 to 17%. You know what I'm saying? Look at God, but look at you because you got the answer right. Phases of moons. All right. So think about that. Physiological adaptation. All right. Third largest section on the NCLEX. All right. Hey, remember content, Q&A, rationales. That's what you need. All right. Here we go. Question number 24. An infant with hydrocele is seen in the clinic for a follow-up visit 1 month after. The scrotum is smaller than it was at birth, but fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Massage the groin area twice a day until the fluid is gone. Referral to a surgeon for repair. No treatment is necessary. The fluid is absorbed normally. Or keeping the infant flat supine position until the fluid is gone. What are we thinking? Hey, if you guys are new here and you guys don't know, I have been a nurse for 3.5 years. I have worked in a burn ICU, a medical ICU, and I floated down and mingled in the neuro ICU. I've also floated to med surg a few times. Been in the Navy for 16 years, so I'm on that downward slope. Been an instructor for about almost 9 years in January. So shout out to all y'all for being here. I actually enjoy being here. I enjoy doing this. We do these Monday, Wednesday, and Friday at 5:30. So I appreciate all you guys in here rocking with me. So also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not in the nursing journey, what are you doing here rocking with us? Also, we need 40,000 likes. What are y'all doing? Here we go, y'all. Here's our answer in 3, 2. And the answer is C. No treatment is necessary. The fluid is reabsorbed normally. A hydrocele is a collection of fluid in the scrotum that results from patent tunica vaginalis. Illumination of the scrotum with a pocket light demonstrates the clear fluid. In most cases, the fluid reabsorbs within the first few months of life, and no treatment is necessary. Part of physiological adaptation, third largest section on the NCLEX. You guys are going to see a lot of physiological adaptation. A lot. I don't know why it's not the first, but it's a lot. All right. But management of care. Remember, management of care, pharmacology, physiological adaptation are the 3 largest sections. They make up 44 to 49% of the entire NCLEX exam. Shout out to Jamaica. I've always wanted to go there on vacation. But shout out to Jamaica. All right, here we go. Question number 25. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling in the hands and feet and cannot tolerate touch of any kind. Which of the following is the most likely explanation for these symptoms? Is it A, inadequate tissue perfusion leading to nerve damage? Is it fluid overload leading to compression of nerve tissue? Is it C, sensation distortion due to psychiatric disturbance? Or is it D, inflammation of the skin on the hands and feet? What are we thinking? Alan says A only. Okay. Everybody else is saying A. Shout out to y'all. Hey, we got to 40,000 likes. I appreciate y'all. 40,000 likes, and we ain't even got to 40 questions, man. So shout out to everybody that's in here rocking with me. Hey, so I got these questions off nurseslabs.com. Nurseslabs.com. Caitlin says, where am I on my nursing journey? I'm an MSN. I am still having nightmares about the NCLEX. Yes. Hey, that's okay. You can have nightmares about it. Yeah, the NCLEX is living in your head rent free, and you ain't taking it in so long. So look at that. Ain't that funny? It's funny how that goes. That's why you better keep those CEs up so you don't go back and take it. All right, y'all. 10 seconds. 10 seconds. First year nursing student. Shout out. Is it Cheryl? Shout out to you, Cheryl. Autumn says B. Devin Smith, thank you for the follow. Amen. Yes, ma'am. RMN in UK. Shout out to the UK. Jay, thank you for the follow. All right, y'all. Here we go. Here's our answer. In 3, 2. And the answer is A. Inadequate tissue perfusion leading to nerve damage. Patients with peripheral vascular disease often sustain nerve damage as a result of inadequate tissue perfusion. Our intermittent claudication results when blood flow distal to the occlusion was sufficiently compromised, resulting in fixed oxygen delivery that is unable to match oxygen demand. Physiological adaptation, third largest section on the NCLEX. You're in a MICU, a medical ICU. Shout out to you in Nashville. I've always wanted to go to Nashville. and, you know, get a real Nashville hot. You know what I'm saying? I'm gonna go there one day. So, but physiological adaptation 11 to 17% on the NCLEX. It is the third largest section. Okay, third largest section on the NCLEX exam. So shout out to all y'all that got that right. Hey, by the way, I'm gonna actually be doing some group coaching, aka we're gonna be doing NCLEX group coaching. I'm doing it for 10 people. I'm actually getting some stuff taken care of right now for that. And the only way that people are going to know about it is if you sign up for the wait list, because the wait list is those are going to be the people that get it. So when that time comes, be ready for it. I'm going to send out a big old email to all those saying like, hey, first come, first serve, first 10 people. You guys get to be a part of it, working out all the details. But hey, as long as you're a part of it, you're going to get all the details once we jump into it. But it's the bootnurse.com/waitlist. You make sure you guys go over there and check that out. That link is also in my bio that you can check out as well. Okay. Here we go. Question number 26. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? All right. So how is hepatitis A spreaded? Right? Is it sexual contact with an infected person or partner, contaminated foods, blood transfusions, or illegal drug use? Who said AB? What you mean? You mean AB? Felicia, you still here? Dang, you already know what I was about to say. Hey, but shout out to all y'all rocking with me. Got these questions off nurseslabs.com. Everybody's screaming B at me. Got a few people screaming A at me. Yes, sir. All right, I see you out there. All right. But yeah, nurseslabs.com. Free sets of questions. You guys go over there and check those out for yourself. All right. And also, hey, we're trying to get to 50,000 likes. Hey, get carpal tunnel for me and stop playing games. Get carpal tunnel for me. It says, yes, Jan says hepatitis A comes from the $. Yeah. All right. Well, let's find out what that answer is, though. Let's see. Here we go. Here's our answer in 3, 2. And the answer is B, contaminated foods. Right? Hepatitis A is the only type that is transmitted by the fecal oral route through contaminated foods. That means you nasties that don't wash your hands when you come out of the bathroom and then you start fumbling through your bread like they're a deck of cards. Yeah, I'm talking about you, all you nasties out there. That's how hepatitis A spreads. Kids are notorious for doing it, like picking their butt and then trying to look. Hey, to toddlers, it's the toddlers that are the worst. They're curious about everything, right? So safety and infection control. Smaller section. We have talked about safety and infection control, but exactly, it is infection control. We got to prevent that. Hepatitis A, think of hepatitis anus, or like somebody said, hepatitis A comes from the ass, not a donkey. But I mean, it could be represented as a donkey, however you want to do it, right? So shout out to everybody that got that right. Hey, if you're thinking about somebody said hepatitis B. So we think about hepatitis B, think of blood and bodily fluids. Blood and bodily fluids. There you go. Hepatitis B for blood and bodily fluids. Okay. Here we go. Question number 27. Gina says, just signed up for your group. Hey, yes, ma'am. Hey, salute. Appreciate you. Hey, some stuff's going to be coming out real soon. So like I said, those that are on it, be ready for it because it could come out. I could send it out at 2:00 in the morning. I'm not going to do that to y'all. I'll make it fair. I promise. Here we go. Question 27. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? All right. So what medical condition will prevent this relative from donating blood to somebody who has leukemia? So if you need to rewrite this question or even restate this question, do that to make it more sense for you. All right. Don't sit here and just try to sit here with confusion and be like, does it mean this? Yes, that's probably what it means. Don't add more or drop anything because then you can get the question wrong. OK, is it A history of hepatitis C 5 years previously? Cholecystitis requiring cholecystitis requiring cholecystectomy 1 year previously? Asymptomatic diverticulosis, or is it Crohn's disease in remission? What are we thinking? All right, we got some A's out here. Shout out to all 221 of y'all. You guys already know the deal. It says, can you please put your website for wait lists on more than one time? Lizzie, look, I'm working on doing some things, but if you need to, you can check my link out in my bio up here under this stubby finger. And I have all my links under there as well. So, and to include the wait list. All right, but here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is A, a history of hepatitis C 5 years previously. Hepatitis C is a viral infection transmitted through bodily fluids such as blood, causing inflammation of the liver. Patients with hepatitis C may not donate blood for transfusion due to the high risk of infection in the recipient. So that is part of physiological adaptation. Who said that? Lizzie? Lizzie, you're welcome. You are very welcome. Do you do these? Do you do this every day? No, I do the Monday, Wednesday, Friday, 5:30. So physiological adaptation, 11 to 17% on the NCLEX exam. Anybody that has hepatitis C, you are correct. Who said that? Is it Allen? Mr. Allen, you are very much correct. Anybody that has hepatitis C can't be a donor, right? Because of the risk of infection is too high. I can clean it and filter it all I want, but there's still the chances of it making its way through, right? So physiological adaptation, don't y'all forget that. Once you understand the topics, you can narrow it down. Okay, you can narrow it down. Here we go. Question number 28. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? So which one of these medications would I not give to this patient? So 3 of them I'm going to give. One of them I'm not. The one I'm not going to give is the correct answer. All right. Here we go. Who said something about NSAIDs? Who said that about NSAIDs? Jesus is king. Yes, Lord. A could cause a GI irritation. Okay. A because of NSAIDs. Okay. A, we got D. I literally about to say Sherbert, but your name's not Sherbert. Is it Shabet or is it Shabay? I don't know which way I said it. I'm sorry. Samuel says A. NSAIDs hurt the tummy. They do. They do hurt the tummy. It's because risk of bleeding. Okay. Okay. What else? Like ibuprofen. Yep, ibuprofen's an NSAID for sure. We got A. We got A. Okay. All right, I'll give you guys 5 more seconds. In 4, 3, 2, and the answer is A, naproxen. So naproxen sodium is just like what you guys said. It is an NSAID, a non-steroidal anti-inflammatory drug that can cause inflammation of the upper GI tract. For this reason, it is contraindicated in a patient with gastritis. Right? So that's part of physiological adaptation. It is physiological adaptation, which is 11 to 17% on the NCLEX exam. 11 to 17%, third largest section, okay? So now that you understand, once you see these questions enough, you will be able to understand what category or what client need that it is and what category you can hone in on. Okay, so shout out to everybody that got that right for paying attention. You are correct. And NSAID, not for GI, because it can cause further irritation, right? Here we go. Question number 29. The nurse is conducting nutrition counseling for a client with cholecystitis. Paint the picture. What causes cholecystitis? Think about that. Which of the following information is important to communicate? So a patient must maintain a low-calorie diet, must maintain a high-protein, low-carbohydrate diet. The patient should limit sweets and sugary drinks, or the patient should limit fatty foods. What are we thinking? Gigi says D. Gina says D. Damn, Gina. Bye, Felicia. Look, y'all already got the names, and I just can't. I can't. He is saying it too well. What? What happened? What'd I do? Damn, Gina. Why you do me like that, baby? No, I'm just playing. Shout out to y'all. Here we go. I'll give y'all 10 more seconds. 10 more seconds. So we got some C's. We got some D's out there. All right. Yes, Jan says D. Okay. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D. The answer is D. Throw some D's on it. No, but the answer is D. But the patient should limit fatty foods. Cholecystitis, which is inflammation of the gallbladder, is most commonly caused by the presence of gallstones, which may block bile from entering the intestines. Patients should decrease dietary fat by limiting foods like fatty meats, fried foods, and creamy desserts to avoid irritation of the gallbladder. That's part of health promotion and maintenance, which is 6 to 12% on the NCLEX. So all the foods that you overindulge on, you might want to limit them. Or should that gallbladder coming out? You know what I'm saying? I booked a call with you, having hope. Lizzie, I got you. I just saw your name come across my screen. Lizzie, I got you. I'm going to take a look at that. But health promotions and maintenance, health promotions and maintenance. All right, here we go. Question number 30. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? Is it slow, deep respirations, stridor, bradycardia, or air hunger. Just bought a Cadillac, throw some D's on it. You gave me motivation to open my book. Hey, look, open that book or use whatever type of study material that you have. Look, you can't put a book in front of Kevin. You can't do that. And by that, I'm speaking in third person because I'm Kevin. Because I'll fall asleep. So that's another thing that you guys got to think about when you guys are studying. What type of learner are you? Are you a read write? Are you visual, kinesthetic? Are you auditory? Are you a combination of all of them? You know, you gotta really hone in on what you need to do, on what type of learner you are. Okay. But all right, what are we thinking? We got people saying B. We got Aisha says D. Aisha, your name looks so familiar. I feel like, are we talking tomorrow, Aisha? Are we talking tomorrow? Got D. And Willow says A. I am not. Hey, so give me, you say D or B. You got to give me one. Gina says B usually is airway problem with anaphylaxis. Alan says D. Alan, I need to know, Alan. Alan, what is your, I don't know if you said it, but what is your area of expertise, Alan? I want to know. I don't know why. I'm curious to know, sir. Hey, if you guys are just now joining, we're on question number 30 of doing NCLEX questions from nurseslabs.com. Free sets of questions. Make sure you guys go over there and check that out for yourself. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. And smash that like button, share, and follow. But here we go. Here's our answer. Lizzie says it's definitely D. All right, Lizzie, let's see what the answer is. Here's our answer in 3, 2. And the answer is D. Cardiovascular Lab, 23 years. Shout out to you, sir. Shout out to you. I'm in Houston. Shout out to H-Town. Here we go. But the answer is D. It's air hunger. Let's see why the answer is D. This is why it's so important that you read your rationales, ladies and gentlemen. All right. Patients with pulmonary edema experience air hunger, anxiety, and agitation. You ever seen somebody that's having an MI? Go into an emergency room or be in an ICU or anywhere on a floor and watch somebody that starts displaying signs and symptoms of having a myocardial infarction. And of course, you're looking at your EKG monitor at the same time. Patients usually present with shortness of breath, which may be acute in onset, which goes from minutes to hours, or gradual in onset occurring from hours to days, depending upon the etiology of the pulmonary edema, right? So once you start to see that, they're going to start having shortness of breath. Right? It says, got to hop off. What days do you do this again? Monday, Wednesday, Friday, 5:30, Felicia, right? So you got to really pay attention. Pay attention. You got to pay attention. A lot of these were signs and symptoms, right? Until what number is this? What do you mean? I don't know what you mean. I don't know what you mean. But hey, physiological adaptation, 11 to 17%. All right, 11 to 17% on the NCLEX exam. Monday, Wednesday, Friday at 5:30. So 6:30 Central Standard Time. All right, 6:30 Central Standard Time. That was question number 30. Yep, question number 30. And that, ladies and gentlemen, at question number 30, we are complete for tonight. See you on Friday. It says, yeah, I have a feeling normally with pulmonary edema, it's crackling, not stridor, correct? Yep. Stick to your number one choice. That's what, hey, read your question. RTFQ. RTFQ, ladies and gentlemen, means read the fucking question. Read it. Don't read too much into it, but read it. Just wanted to tell you that I passed my NCLEX, Kevin. Yes, Lord, that's what I'm talking about. Hey, so you're the first person to come in here today to tell us that you passed your NCLEX. Once again, I'm proud of you. Congratulations. What type of nurse are you? And then what advice could you give to the almost 200 people that are in here rocking with us? All right. Also, hey, I appreciate you guys participating. Participation is the key. This is why I do it. I love the feedback from all of you. So I appreciate you guys being here. The love, the likes, I love it all. I had to ban a couple people. I don't remember their names, but I'm petty, so I'm just letting y'all know that I banned them. Nurseslabs.com is where I got these questions from. Nurses meaning more than one. Labs meaning more than one. Put those together. Nurseslabs.com. Go over there and check those out. Free sets of questions to you and me and to the rest of the world. 7-day NCLEX course. That is my NCLEX course. That is $97. You have it for free. Oh, not for free. Oh my God. You have it forever until you pass away and you give it to your descendants. You know what I'm saying? The ancestors willing. Gina, thank you, Kevin. See you Friday. All right, Gina, see you Friday. So you guys can go over there and check that out. Also, got a free download. You guys go over there and check that out as well. I do tutoring, coaching. I got an ebook. All those are in there as well. And right now, I'm about to turn this camera around. Wait, hold on. What's somebody saying? I bought the 7-day NCLEX course. Just wondering, is it the same as the Victory? No, the 7-day NCLEX course is the online course. What's up, everybody? So the 7-day NCLEX course is the online actual course, and but the Victory Guide is just the ebook. The Victory Guide is just the ebook. But shout out to all 140 y'all in here rocking with me. If you guys are just now joining, we just finished doing NCLEX questions. We do NCLEX questions Monday, Wednesday, Friday, 5:30. Sorry if my eyes look a little puffy. I'm suffering from these allergies out here in San Antonio. It's wild. If you're a San Antonian, it's wild. So it says, what is the difference between? Well, the difference between is that one is an ebook that you could print out and you can take with you. And the other one is online, or you can download the Kajabi app where you can actually go through the lessons, as well as I have a new generation NCLEX review that's inside of the 7-day NCLEX course, as well as I'm putting the 7-day NCLEX course right now. There are 3 out of the 7 days that are in there. Because, I'm a one-man army, so I got to record and edit, all that good stuff. But that stuff is going in there as well, where I break down each section. Hey, everyone, thank you so much for this review. Ashley, you are very welcome. Are we allowed to have the answers for a study guide? What do you mean? Oh, so by the way, all of these lives will end up going on YouTube. So if you miss a live at any point in time, you can just go to YouTube and check out my YouTube, watch the live over there, because I'll update or upload them all up over there as well. So, hey, what questions do you guys have? Aisha, thank you for the rose, ma'am. Thank you for the rose. I appreciate you. Is it Mindy? Thank you for the follow. Appreciate you. Do you have, it says, do you advise to write or type material for studying? So, Jen, my nursing student, that just depends on you. Like me, I was that type of person to where I enjoyed looking at the PowerPoint. So I would print the PowerPoints and I would write notes as I was going through the lectures. So, the majority of what I needed to know was there, and then I would write them out to the side. So I kind of like, not paraphrase, but I kind of like fast do my notes as in like what I thought was important. So, I'm a big person on knowing about numbers. Numbers are probably by far one of the most important. Had no idea you had YouTube. Yes, Ashley, I have a YouTube. So you guys can go and check my YouTube out. It's actually linked in my TikTok bio. It'll take you straight there. And I have TikToks that have been on there, I think, since like March. So yeah, you guys can definitely go over there and check that out. Any tips for starting my path for nursing? First of all, ask yourself why you want to become a nurse. I would start there. That'd be number one. The next thing I would say would be to understand the path that you're about to take on, because it's about to be a journey. It's an endurance journey. And then I would start looking into the schools that you want to go to, understanding their prerequisites, and then start taking your prerequisites. That's what I would think. Who says that? A BFF Aesthetics says, hi, I have to take Pharm, Med-Surg, and Patho next year. Any tips for those classes? For pathophysiology, I loved Khan Academy's pathophysiology, but that's one of my favorite classes. Pharmacology, they have like PharmD on YouTube. They have so many, like Osmosis is a good website. I have an NCLEX course where I have like 18 videos on pharmacology. You can check that out. That link is in my bio. Also, you can, but anything like on YouTube, they're really good. Now with Med-Surg, I tell people to get into a small group of people. What's up, Kate? I know you're in here lurking. So I would recommend getting into a small group, 3 other people, and then splitting that up 25%, and you do 25% and you reap 100% of the benefits. I see you, Kate. What's up? How are you? How do you study for NCLEX? I just graduated and I feel lost and don't know where to start. So you definitely want to start to where your number one pain point is. For mine, it would be pharmacology. That's where I started. But if you're looking for further guidance on where to start, and essentially kind of how to guide you through it, I do coaching, and you can check that out in my bio. But Jean, is it that girl Nana or Nana? Are you a Nana? Maybe. But I would recommend starting with your number one pain point. So if it's pharmacology, start there. If it's mother baby, start there. I write my rationales after I quiz myself, and it helps so much. So everybody's different. So shout out to you, Ashley. Everybody's different. You're not going to see me sit here and try to write out my rationales. Me, it is all about repetition. I have to do it, see it. Please, can healthcare assistants write NCLEX? They cannot. You have to go through an accredited nursing school, and then you have to graduate from that nursing school with a diploma, a degree of some sort before you can take your NCLEX. Tim says, a lot of the RNs I work with say I should go PA. What do you think? I don't know, Tim. It depends on you, because you can go PA. You could go PA, or you could go nurse practitioner. But a lot of them are telling you based off of their experience. Here's what I'm saying. If you want to go and you want to be a nurse, go be a nurse, right? When I tell you that there are so many different ways for you to get to your end goal. So many different ways to get to your end goal, right? So many ways. Repeat, answer, please. Was it Harmon? I don't know what you asked me. What was your tip for med surg and mental health? I didn't give one for mental health, but for med surg, I said you definitely want to get into a group. As a matter of fact, understand how the group, small group, understand getting into a group and getting into the group and doing the team method, because that's the method you're going to have when you start working out, on the floor. Good. How are you tonight? Oh, you know me. I'm always out here trying to drop the knowledge, Kate. I'm always out here trying to do it. Do you have any advice when interviewing for a job? Always ask how long the orientation is. Ask how long the orientation is. Of course, it always buckles down to pay. Ask about how many preceptors you're going to have, so on and so forth. I'm trying to go off the top of my head. I had a green book. I asked them what are the opportunities of growth inside of the unit. What are my resources that I'm going to have? If I don't know something, will my resources be available? What is the unit morale like? What is the unit morale like? Because I'm telling you right now, if you are in a unit, it could be a thriving machine, but if that machine is a toxic machine, you don't want to be there. Trust and believe me when I tell you that. Can you break down what your coaching includes? So Alicia, if you go to my website for the coaching will literally I even have a video. It's like 12 minutes long. It'll literally break down everything that the coaching does. But to give you a little bit about it, you essentially get 1 hour plus calls with me, like it's a personal thing. But I say that very vaguely because in reality, you get as much time as you need. So if you need an hour and a half, cool. If you need 2 hours, cool. We make it work depending on how the schedule is. We break down NCLEX style questions together. We create a calendar for you. So like if you don't know where you need to start. So let's figure out where you need to start. We do a tracker. We go through questions. You get my cell phone number. Like you get all that stuff. Like when you get me. Like, so however we do this thing here on live, imagine this, but like times 10, right? You get nothing but like mentorship and motivation. Like I talked to a young lady yesterday and she was just like, hey, what do you think about, being an OR nurse? And I was like, cool, let's talk about that. Like we talk about, we can go more into interview process. It all just depends on what you need. Is Saunders good? I think Saunders didn't work for me. Saunders was just too vague and I hated reading out of the book, right? Dan says, pay for further education. Are you asking me or are you telling me? Alicia says, thank you. You're welcome. Can a new grad go into the ICU? Absolutely. As a new grad or as a new hire, I had got my license in 2020 and then I did an internship / worked. It's kind of like, it's something that the military has, but I was working in a burn ICU for 6 months. So, and I was a new hire and then I got hired into another hospital right out of there. So as a new grad, they do have that. They're going to try to rope you into a residency program, especially if it's an HCA hospital. Now at that point, you got to determine on what you want to do, right? So what branch? I'm in the Navy. I'm currently still in the Navy. So, is it Elsier? Did I say that? I want to become a nurse, but have no clue what or where to start. So I just gave somebody some advice about that, like a whole 2 minutes ago. I don't know if you were here for it, but the number one thing is that you said you want to become a nurse. Number one, you need to ask yourself why you truly want to become a nurse. Secondly, you need to start looking at schools that are around you. And then you need to start seeing what their prerequisite requirements are. And then you need to start jumping into those. How do I feel about residency programs? I think that they're good if they are structured properly. Like for example, I hate an ICU residency should not be 12 weeks. You know what I'm saying? An ICU residency should not be 12 weeks. It should be 6 months because there's so many intricate parts inside of an ICU that you need to know and be familiar with, and there needs to be consistency in regards to disease processes. Like I should be able to give you a DKA patient a lot. I should be able to give you 5 DKA patients within not multiple shifts, but consistency. That way, by the time I give you a DKA patient, you're going to be able to float out there on your own versus me giving you a DKA patient and then me giving you a septic patient and then me giving you a dying patient and then me just leaving you by yourself. Because when I was going through residency at one point, that's exactly what they were doing. And I'm just like, bro, like there's no consistency here for somebody to conducively learn. And I'm an instructor, like I am an instructor. So I understand why the consistency needs to be there. If you're all over the place, how are you going to learn effectively? A lot of people say, trial by fire, shoot from the hip. That's not a conducive learning environment for Kevin. And I don't recommend that for other people. But, those are the risks that you take when you go to work at these hospitals that have, residency programs that are world renowned. But, you got to experience those things for yourself, I guess, sometimes. It says, how do you feel about residency? Okay. Have you ever I have heard of Nightingale, but I've never done anything about, like, you're like the maybe fifth or sixth person to talk about Nightingale. I am starting a new grad nursing residency program on the ortho trauma unit, and it's a year long. That's good, Alicia. That's actually really, really good. Here's the thing. The residency program itself is a year, but the orientation, meaning where you have like somebody that's with you, could be way less than that. It could be like 6 weeks. And after 6 weeks, they'll be like, all right, Alicia, there you go have at it. How do you get around the inconsistencies? You have to be verbal. So 2 things. If you start realizing that things are starting to go like really crazy, you have to be verbal. You have to be able to express yourself. And a lot of new nurses don't do that. A lot of new nurses are just very scared to say anything, because they're afraid of, getting fired, or they're afraid of how other people are going to treat them on the unit. And other people are just like, yo, I had to do it. Suck it up. Look, hey, bro, just because that happened to you doesn't mean I want it to happen to me, number one. And number two, for the fact that happened to you, I'm sorry. I don't wish that. I didn't wish for you to learn that way, but, that's just kind of how it goes. But around the inconsistencies, that's kind of hard. It's kind of hard because, your floor, depending on where you go, you may not have stuff like that. You may have the inconsistencies where you have just different things happening. You kind of just got to go with the flow. What's up, Cass? Ma'am, I ain't seen you in forever. Always out there hiding from me. You be out there in the prisons beating folks up. I already know the deal. Don't be out there fighting folks. You already know the deal. If y'all don't know Cass, she was my bouncer up here and used to just, hang out in the lives and was my moderator. Then she just told me to go, kick rocks. And I was like, damn, how much is your coaching? Aisha, you can go check that link out. It's in my bio, and it varies because it depends on what you need. Everybody is different, so it just really just depends on what you need. Thank you for answering the question. Have a good night. Tim, you are very welcome. Do I do private coaching? I do. Like I said, you can check that link out. It's in my bio. Alicia says, how long have you been a nurse? How long have you been teaching? You're doing great. I've been a nurse for 3.5 years. I've been teaching it'll be 9 years next month. Actually, I think on the 9th, it'll be like 9 years that I've been teaching. And I appreciate it. I really do. I love teaching. How do you feel, or how did you feel after passing your NCLEX on the 3rd time? So I actually failed my NCLEX 3 times and I passed it on the 4th. I passed it, and for about 5 to 10 minutes, I was on a real dopamine high. And then after that, I said, okay, what do I do now? It's like, okay, what next? I'm grateful I discovered your page. Well, I'm grateful that you're here. Is it Tua 11? I appreciate you. I took a mini vacation. Wife and I got married. Shout out to you. After being single for 10 years. Hey, shout out to you. Shout out to you. Congratulations. Welcome to the married life for you. I was already a part of that. I'm not part of that anymore. So, tips for med surg. Get into a study group. 4 people. You do 25% of the work, so on and so forth. 25% of the work reaps in 100% of the benefits. So, shout out to you, Miss Cass, for doing your thing. And is it D Burger? Shout out to you for your question. But hey, if you guys are new here, hey, we just did NCLEX questions. We just did NCLEX questions. We do them Monday, Wednesday, Friday at 5:30. Ashley said, I brought your NCLEX victory, guys. Shout out to you, Ashley. I appreciate you. Hey, I think you'll like it. Hey, it's 700, total of like 782 pages. 782 pages. It's wild. I'm actually working on an audio, like the audio version for that as well. So if you're one of those people that has a commute to drive into work or anything like that, boom, like you just, pop in that good old 8-track. First of all, I am not even from the era of 8-tracks. Pop in that good old cassette tape, you know what I'm saying? And just go ahead and listen to your boy talk about, whatever. So, working on some stuff right there, right? It says, leaving to check out the YouTube channel. Got to study for the NCLEX. Have a great night. Good luck, everyone. All right, Alicia, appreciate you being here. Yeah, go check that out. Let me know what you think. Let me know what you think of it. Ashley said, I'm so excited about it. Thank you for making it available. I am. Will that be available? So it won't be available yet, but for everybody that has already purchased it, it's going to be free. So I have everybody's information. So I'll literally just go find those people and be like, hey, since you had already bought it and you had already invested in it, here you go. So I'm going to give you guys the audio once it's available. So you don't even got to worry about that. Miss Ashley. Summer, what made them change the NCLEX? Not sure if you know. I'll answer your question. Awesome. Thanks. You're very welcome. I meant I wasn't getting married, but she's amazing. Thank you. Got you. Tracking. It says, what made them change? So they changed the NCLEX based off of what we call so they changed the NCLEX based off of, professional or, profession feedback. Well, in the Navy, we call it fleet feedback. So we send out surveys and all this other stuff to hospitals, institutions, and everything about what things need to be changed and what things need to be added. So after some time, they realized that, hey, we need to add these things to make it more conducive to the real world. Instead of me just giving you multiple choice answers and select all that apply, I need to be able to give you the whole scenario, hence the case studies, of what a patient may or may not present to you. And then I need to be able to give you things that are happening in real time. That way, you know what to do. So if I give you a whole case study and then, an hour later, the labs come back, which hopefully it's not an hour later, but an hour later, the labs come back. And then, 2 hours later, you notice that the EKG rhythm is changing. Like, you need to know what to do, in chronological order or in real time as things are happening. So that's why they changed it. It's because they're trying to make it more realistic and conducive to what you will see out in the real world. Okay. So hopefully that answered your question, Miss Summer Jade. I was going to call you Sexy Red, but I think I already gave somebody else that name. But, and I don't need her coming in here and be like, oh my God, you're calling somebody else Sexy Red. Like, why would you do that? But hey, if you guys are finding value, I appreciate you. Hey, smash that like button. Hey, give me the 50,000 likes. Give me 50,000 likes. Get carpal tunnel for me right now. Hey, but if you guys are just now joining, we did NCLEX questions. Like I said, we do NCLEX questions Monday, Wednesday, Friday, 5:30. And after that, we do an Ask Me Anything. And so essentially, you guys have to, have the time to ask me essentially whatever you guys need to ask me in regards to, nursing, NCLEX, as well as, if you're a pre-nursing student trying to figure it out, if you are trying to study for HESI, ATI, all that good stuff. So how much time should you take to study for NCLEX? Natalie, it just depends on how much time you have available. Everybody's situation is different, but if you want a good rule of thumb, a lot of people say 4 to 6 hours. 4 to 6 hours. I'm going back to get my MP, working corrections, of course. Hey, go do your thing. Go do your thing. Hey, and when you graduate, give me the answers. I'm just playing. But congratulations to you. Go out there and do your thing, becoming a nurse practitioner. I'm also going back to school to get my master's. I'm going to get it in education, for obvious reasons. I like to be out here teaching. And I don't know if I'll go back to get my doctorate. Everybody's just like, you should go get your doctorate and blah, 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 blah. And I'm like, all right, cool. How do I apply for medical school from an undergraduate? Shit, Camila, I wish I could tell you because I'm not a fucking doctor. So I'm just playing. Hold on. I got you. So here's the biggest thing about when it comes to medical school is that with medical school, you have to, number one, do all of the prerequisites for the medical school. Like, you need to do all the medical prerequisite classes. Like, if it's calculus, organic chemistry, inorganic chemistry, physics, like whatever those classes entail. And then you don't really necessarily get a degree in trying to get into medical school. But most people that get their degrees are something like biology. But medical school actually likes to see people that get a degree that has nothing to do with science, but they also have the medical classes. So I have a buddy of mine who got into medical school. He's now an optometrist, and he got his bachelor's degree in like sociology, but he had all of his medical classes like already covered. And then he got into school, did his thing, and now, he's out here working as an eyeball doctor. Or ophthalmologist. I think that's what he's either an ophthalmologist. That's what he is. So, that's what he does. And that's what I would recommend that you do. And then when you apply, I don't know the intricacies of applying for medical school, but I'm assuming they're the same for applying for nursing school. They have their requirements. You need to be able to provide them, and you should be good. So if I took psychology courses and didn't take any biology classes, I won't be able to get into med school. No, you need to be able to, if you want to get into med school, you need to know what the required prerequisite classes are in order for you to get into med school. Just like that. How was your nursing journey during nursing school? It was rough. It was rough. I was working active duty in the Navy while I was in nursing school, while on top of being an instructor. So I was teaching in a surgical technology program while I was in nursing school. So you will still need, of course, you're going to need biology. You're going to need biology, but you're going to need the biology classes are going to be, everything that entails of whatever those prerequisites are. So how did you do that? First of all, I had a really good chain of command. That was one. That's another thing. If you guys don't realize it, with the military, it's always mission first. If your personal shit comes in the way of the mission, the military could just be like, nah, we ain't doing that, and we're not allotting the time. Luckily for me, I was in the right time in the right place for me to actually pursue that goal, and I did what I needed to do, and they were very supportive of that. But my school was 100% online, but all of my clinicals were done in the hospital. So, and this was prior to COVID, because this was 2017, 2018. So, yep, that's how I was able to make it work. But shout out to all 50 of you guys in here rocking with me. If you guys are new here, welcome. We did NCLEX questions. Now we're doing an Ask Me Anything. So did the military pay for your schooling? They did. They paid for my school. I have what is called the Montgomery / post 9/11 GI Bill, and they paid for, in that bill, or that, what's the word I'm looking for? That, I don't know, not privileged because I paid for it, but that bill actually paid for me to go to school. And I actually still have 18 months left on it. So as I'm going through my master's program, the last 18 months of that entitlement will pay for me to get my master's. And they also have other ones out there for veterans and for active duty folks, for them to get their continuing education, to get their doctoral degrees and stuff like that. So yeah, there's tons of opportunities that are out there for sure. Is it Lovo Mom 7? Appreciate the follow. Thank you. But what other questions do you guys have? I'll hang out here. I'll hang out here for as long as you guys want me to hang out here. I usually get off at about, 8 o'clock, but probably going to call it early for today. Had really good participation today, which I really, really love. So I appreciate everybody being out here. What else you got? Did you ever think of becoming a military nurse? Trust me, I thought about becoming a military nurse very early in my naval career. I've been in 16 years, and every turn. So I wanted to be a Navy nurse. I didn't want to be in the Army, and I didn't want to be in the Air Force. So I stuck with the Navy. Navy never wanted me to be great. So I applied for multiple officer programs while I was active duty in the Navy, to include the nurse candidate program, the medical enlisted commissioning program, and the seaman to admiral program. Didn't get picked up for any of those. And then I tried to do a direct commission, but at that point in time, they wouldn't let me get in unless I had a year or two of experience. And then when I finally do get the experience, I've literally been dragged along for over a year. Literally, I've been dragged along for over a year. So those that are trying to go into the military, realize if you're trying to go into the military and work as a nurse, it is a long process, especially if you're trying to do direct commission. So I haven't heard anything back. And it's been literally, I started this process a year ago in November. So now it's just to the point to where I'm just I'm not really worried about it, because I'm just not really worried about it. I have enough time in the military to know, when it's your, not to give up, but when to focus all of your energy somewhere else. My clinicals are in a CVICU this semester. Any tips? Be a sponge. And here's the thing, Ashley, if you are in a CVICU and if that's where you plan on going, if you have ambitions to be a CRNA, I'm telling you right now, be attached to the hip, take notes, be a sponge, ask your preceptor as much as you can without, being, overly ambitious, because, it's exciting. Like the CVICU, there's a lot going on. But if you can get in really good there, especially if you want to get a job and if you have other ambitions, 100%, be a sponge for sure. Yes, I'm so excited, but nervous. It's okay for you to be nervous. What did I say about being nervous and scared? That's okay for you to be that, but you're going to do it anyway. You know what I'm saying? You're going to do it anyway. Hey, for all 53 of y'all, if you guys are finding value, smash that like button. Give me that 50,000 likes and stop playing games with me. All right. But it says, hello, sir. I need a guide to do NCLEX. I'm all the way from Gambia in West Africa. Shout out to you, Miss Ma'am, being all the way in Gambia. So I have multitudes of things that are out there for you. Raquel, what is funny? What I say that was funny? Like, what is it that Kevin Hart did? Just like, no, you did not just double pistol me, right? But for user 24, ma'am, I have a free download that's up there in the link in my bio. I have an ebook. I have the 7-day NCLEX course. If you're looking for something more private and more personal, I do one-on-one tutoring and coaching as well. You can check that out. So I love the positivity that you give. Here's the thing, is because I'm going to give you positivity, but I'm going to be real. I'm going to be 100% real with you. Like, I gain nothing. I don't coddle. I don't coddle you. Like, if you, the only individual that I coddle is there's three people in my house that I probably should I have to coddle them, I guess. But I'm not going to coddle you, because if I do that, you don't grow. You see what I'm saying? If I coddle you, you don't grow. And the whole thing is you have to be able to go through these pains in order for you to grow. I failed NCLEX 3 times, y'all. I failed NCLEX 3 times walking around this. It's kind of like anybody ever seen the Book of Eli? He's just walking and walking like a wanderer, not knowing where the fuck he's going. No, I take that back. He knows where he's going, right? But he's just wandering the earth trying to find his direction to get there, right? And so it took me 3 failures on NCLEX until I finally was just like, hey, bro, get your shit together and figure out a direction. And then as soon as I said that, it was like, I have a light right here. That's why I did that. Y'all like that? Hey, if y'all appreciate that, if y'all appreciate the aesthetics, go ahead and give me the 50,000 likes. Okay, stop playing games with me. No, but I ended up finding a mentor. Or should I say that a mentor ended up finding me. And it's probably one of the best things that ever happened to me is when I found a mentor. Like, I'm not even going to lie to you. Because he literally told me in very explicit words. And I even talk about him. If you go to my YouTube, I talk about him often. And he told me essentially, like, what the fuck are you doing? And I'm just like, I don't know. And he was like, well, you've been doing this 3 times. Obviously, you're not doing some shit right. And I was like, I know. Help me. And he did. He helped me. And with that guidance, it's like, if it wasn't for that happening, I wouldn't be here, the person trying to do the same thing for y'all. You know, but this is more on a massive type of bigger scale. You know what I mean? So, like I said, I don't coddle. You got to understand like what your pain problem is. And then you have to be able to kind of hone in on that. So if you know that you're not understanding NCLEX style questions, practice more. You have to practice that. If you know that content is your issue, then fucking look at content. If you are lost, which a lot of people are, and that's okay if you are, because, you know, like nursing school doesn't teach you how to, and I don't care what nobody says, nursing school doesn't teach you how to take the NCLEX. They teach you how to graduate, because guess what? When you get out of school and graduate, they don't give a fuck about you. They'll be like, oh, oops, sorry, my bad. All right, next victim in school, right? So think about that. If that's what you need, you know, then you got to find a mentor. I mentor everybody. I'm here all the time answering you guys' questions religiously, Monday, Wednesday, Friday. And I want somebody to come out here and say that I'm not, because then I'm going to check them. I'm going to be like, who are you and where the fuck have you been? Because I've been doing this for, if you think about it, it'll be like, in like March, it'll be up on a year that I've been doing this on TikTok. So what I'm trying to tell y'all is a lot of people are scared about everything. I'm going to use this analogy, and I really want all 40 plus of y'all to pay attention. If you guys understand what happened. So in 1944, Normandy happened, which is the assault in France where they stormed the beaches, and this is like, there's a lot of things. I'll use a lot of war analogies, right? So the one thing I'm going to say is when they were storming the beach, if you stayed on the beach and you just stood there scared, you died. You were gonna die. It was a 100% guarantee. The only way to survive was that you had to be scared. At the scariest moment of your entire life of you possibly dying. But the only way that you could survive is that you had to run through the rounds being shot at you. That was your only means of survival. If you stayed on the beach, you were gonna die. It was crazy, right? If you ever seen Saving Private Ryan, go watch it. I've only seen it once and I'll never watch it again. So what I say to you is that you're gonna be scared. You're going to be scared. Well, you are going to study for this NCLEX scared. You are going to take that exam scared. And whether or not you pass it or not, if you fail the exam, and I'm telling you right now, because I'm being very realistic, if you fail the exam, If that's the worst thing that could happen to you, I think that's okay, because you know what you can do? Now you can get your performance breakdown, see where you started, where you got below, near, above, so on and so forth. And then you can study from that. What's up, Tatted Mom? What's up? How are you? So you can study from that. So if you go to pharmacological and parenteral therapies and it says below, that ass needs to be studying pharmacology. To me, that makes sense. Right? If you're at physiological adaptation, okay, cool. Let's go to the disease processes and see how they work. Right? Let's look at the acute stuff that's happening. What are the expected and the unexpected things that come out of that? What about my chronic things, like somebody that has COPD or end-stage renal failure? What do their diets look like? Right? What is the potassium going to like? Those are those things that you have to know. And the more that you expose yourself to it, the more familiar that you're going to become with it. And then once you pass your NCLEX, you're going to sit to yourself, well, shit, I can't believe I just made that hard. You know what I'm saying? And this is what I tell people. If it's not in passing, if it's somebody messaging me on TikTok or Instagram or wherever, if it's not somebody that I coach one-on-one, then that's the stuff. You know what I'm saying? So get off your beach. Get off your beach. Get out of your own way. You're going to be scared. Trust and believe me when I tell you right now, nursing school makes the NCLEX like it's the scariest thing on earth. You don't want to take, I'm making fun of this old crusty ass nurse that I had when I was in school. You don't want to take this more than once. You only want 75 questions. Kind of reminds me of Hocus Pocus, we're like this, right? You only want the sminny. And I'm just like, wow, okay. And I was like, so what happens if I fail? You don't want more than this. And I was like, so what happens if I don't do well? Because that's a reality type of question. They were just like, well, if you fail, then you got to study again. Well, that's obvious, bro. Like, but how do you prepare mentally for that? So I'm going to give you guys another gem. You want to study 85 to 150 questions every day to every other day. That's exactly what you want to do, because you want to allot yourself time to absorb all that knowledge. If I told you to start doing 85 questions every day, or 85 to 150 questions every day, and then I told you to turn around and start looking at rationales and reading them and then writing them and then doing all this other stuff, by the time you get to day 3, you're going to lose your mind. You're going to lose your mind. So why lose your mind when you can do it effectively? Notice how I said effectively. Everybody has this race with fucking time, but you want to do it effectively. Effectively, okay? You're going to be scared doing it, but you got to study. You got to put in the work. If you don't put in the work, how can you expect the results? If you guys appreciate that, smash that like button, give me 50,000 likes. Hey, but real quick, if you guys are curious about anything I got going on, check out my links in my bio. I do coaching over there. I got an NCLEX, demand. I got an on-demand NCLEX course, which I'm adding content to it every 2 to 4 weeks. What else do I got over there? I got an ebook. I got a free download over there as well that you guys, it's 42 pages talking about, the common things that you'll see on NCLEX, like keywords to look out for, so on and so forth. You guys can check that out as well. And then, of course, if you need personal help, like 101, where you get this energy that I'm giving all the time to y'all, and especially if you need help with anything in regards to nursing, you guys can check out my coaching. I provide that as well. You guys can check that out. Okay. But what other questions do you guys have? I'm going to hang out for about another 7 minutes. I've been sitting here running my mouth. But what other questions do you guys have? Downloaded the free one. Currently looking it over on my laptop. Shout out to you, Miss Ashley. Miss Ashley is, hey, you are tuned in, and I appreciate you. Y'all have no idea how important participation is here, because I will sit here and I will talk to myself, and people are going to be like, who is he talking to? You never know. You never know who I'm talking. I never know who I'm talking to. Right. So when I first started TikTok, I kid you not, I probably had, no lie, like 2 or 3 people in here, and I would literally talk to them. And at some point, I remember I saw it go to 0, and then I kept saying to myself, nope, keep talking, because eventually somebody's going to see it. I posted that video on TikTok, and that same exact video, I think, had like 400 views or 400 likes or something like that. And I'm just like, oh, okay, well, I guess I wasn't talking to nobody. Somebody heard me. Megan, your jacket. What's up, Miss Lady? How are you? Where have you been? You been hiding? What you been doing out there? Felicia, You're doing good. Hey, I appreciate you. I appreciate you, Miss Ma'am. Hey, I'm just saying. It says, I'm so appreciative of your perseverance. Hey, look, so everybody. So here's the thing. We all have the same destination at some point. We want to be nurses. We want to get into nursing school. We want to graduate nursing school. We want to get NCLEX. We want to start working, right? We all have the same destination, but the journey is going to be different. Everybody's journey is going to be different. Some of them may be relatively close, but everybody's journey is going to be different. All right. Just finished my 10th quarter, 2 more to go. Hey, you almost there. You almost there. And before you know it, you're going to be sitting here and be like, Kevin, coach me. And I'm like, girl, I got you. I got you. And here's another thing. In case you guys didn't know, I had a young lady that I coached, and she just took her NCLEX on Thursday, this last Thursday, and she got her results back on Saturday, and she passed her NCLEX. Y'all, she took her NCLEX, get this, 11 times she took that exam. 11 times. That's one more than 10, one less than 12. One more than 10, one less than 12. If you want to talk about perseverance, that woman could have gave up a long time ago and said, fuck it, this ain't for me. But she literally was just like, I want this. And I'm like, cool. How bad do you want it? Because I can't want it. I can't want it more than you. I can't want it more than you. And she was just like, I want it. And I was just like, then you got to put in the fucking work. And she was just like, I'm going to put in the work. And I was like, I know that's right. And then what did she do? She put in the work. She was coachable. She understood her assignment, and she executed it to the T. And now I can humbly and graciously say that she is now walking amongst us, evolving from LPN to now as a registered nurse. Notice I said evolving. I didn't say, I don't downplay and I don't down talk LPNs or LVNs, but we evolved from that stage of nursing to that next stage of nursing. Okay. You better believe it. I got the boot camp, but haven't started it yet. I think I saw your name on there, Megan. I think I saw that. I think I saw your name on there. So, hey, that's okay if you didn't start it, but what did I tell you? Get it, because because you got it for a low price, and now that price is not going to go back down. You know what I'm saying? So and by the time you use it, everything that you're going to need for the most part is going to be in there. So shout out to you. You already know what the deal is. Good for her. Hey, Tanya, I'm trying to tell you, when I look at her and I look at how she's accomplished things, I tell her all the time, I'm so proud of her. And I'll tell all 50 of y'all, it doesn't matter where you are at in your nursing journey, or fuck it, even in life, I'm proud of y'all. If nobody tells y'all that, I will tell y'all that, because we all need, I'm a big words of affirmation guy. Like, I'm proud of y'all, because no one, it's kind of like where they say, hey, you became an overnight celebrity. Overnight celebrities or overnight successes, take 10, 20 years. Nobody sees the process in between there. Nobody sees the nights that you wanted to quit while you're in nursing school saying, fuck this class, and you're crying on your fucking desk. Nobody sees those. Nobody sees the arguments and stuff that you have with your significant others about not being able to spend too much time with them. Nobody sees that. All they see is, oh, you started nursing school. Oh, you have a license. Oh, must have been easy. Nobody sees that shit. Nobody on the outside sees it. They don't see it. You know what I mean? Nobody sees it. So I see it. And I'll tell y'all that I'm proud of y'all. And every time somebody comes in here and tells me that they passed their NCLEX, I tell them that I'm proud of them. Hell, I don't even remember most of y'all. Everybody know me, but I don't know y'all. You know what I'm saying? But regardless, I'll tell you that. Even if you were somebody on the street, I knew I was struggling. And if you didn't give me bad vibes, I'll dap you up, give you a hug, tell you that you're good to go. Tell you that I'm proud of you and keep pushing. Because I'm telling you, it gets more difficult. The higher that you start to go up, it gets more difficult. And you gotta be prepared for that. The NCLEX is only one step. It's like getting to the top of a fucking mountain, and you're just like, yeah. But then you realize you're at the summit of an even bigger mountain, and it's just endless. That's just kind of how it goes. You're good, people, Kev. I be trying to tell people. People would just be like, oh, he mean, he Orient, he's sassy. They're correct. I'm all of those. But, in reality, I want everybody to eat. Hear me. I want everybody to eat, even if it's not at my table. I promise you. I want everybody to be the best version of them. I want everybody to eat, even if it's not at my table. I promise you. I promise you that. You know what I'm saying? You ain't got to take from other people in order for you to eat. You know what I'm saying? You got to come out here and you got to put in the work so you can know how to eat. And you got to prepare. Those are things you got to do. But anyways, I'm done running my mouth. Any last questions? Any last questions for tonight? Any last questions? Because I'm about to get off. I've already been on here almost it's about to hit the 2 hour mark. So what else you got for me? Y'all got me to 50,000 likes. I am not complaining about that. We had, I think, what was our max? I think we had like a 1.2. Like we had a 1.2K people in here. So why do I always miss your sessions? I don't know. You need to turn on that notification. You need to turn those notifications on so you know that I'm here. When do you usually get on lives? So you tell me you always miss my sessions. So I know that you know when I do my sessions. Monday, Wednesday, Friday, 5:30 Central Standard Time. Just go ahead and put that notification on. Just go ahead. Put that notification on for me. Nobody else, because nobody else is important right now. Yeah, you'll know when I'm jumping on here. You got it? Hey, look, I'm here for you. I'm here for you. Monday, Wednesday, Friday, 5:30 Central Standard Time, aka Texas time, unless you're in El Paso because they're in Mountain Time. But you know that's what we about around here. Is it San or San? First time, welcome. But hey, I appreciate everybody jumping on. I appreciate everybody being, participating. I appreciate all the love. I appreciate everything. But the biggest thing that you're getting something out of it, last non-shameless plug, because I have no shame in doing it. Check out all the links that I got in my bio. Like there's a free download over there for you guys. Also, there's an ebook. I have an NCLEX course that's over there for you guys as well. Just turn on the notification. Hey, all right, Megan, I'll see you, girl. I do coaching. So if you are having a hard time, you failed your NCLEX multiple times, you need guidance on to take out all the fluff to get you to point A to point B, check it out. Fill out, schedule a 15-minute call, fill out the intake form, because, doing all that stuff is a relationship. All right. Doing all that stuff is a relationship. So I want to make sure that it's right for you, but also that it's right for me. All right. So make sure you guys check out all those links that I have over in my bio. Breeze, you're about to start nursing school. Hey, time management, and get ready to be humbled, because nursing school is about to humble you real quick. Also, check me out on YouTube. You guys can see me out over there. If you guys haven't, it's at the Boot Nurse. Lastly, be great to yourself. You're only got one you. You know what I'm saying? We're always the hardest on ourselves. And no one will be even harder on you than you, because you only got one you. So you got to take care of you before you can take care of anybody else. I promise you that. So with that being said, I appreciate everybody being here. If you have any type of questions or whatever, you guys can just, shoot me a DM and I'll try to get to them. There's a ton of y'all and only one of me, so I can't see them all. Make sure you guys check out those links. And until then, I will see you guys on Friday. Bye.